Let's get down to the anatomy of these cartilages. But then if I have to understand the anatomy, I have to start, yes, the first diagram. Come, let's begin our first diagram. Remember, in this diagram, we are looking at the larynx from the side. So you're looking at the person from one side. Okay, let's begin. Let us understand the anatomy of cartilages of larynx by drawing a series of diagrams. First begin to draw the hyoid bone, the lesser cornu, the greater cornu. Remember, we are looking at the larynx from the side. Now we are drawing the thyroid cartilage, its upper horn, upper border, lower border. You can see how lower border is quite straight and the upper border is quite convex. This is the upper and the lower horn of thyroid cartilage. Below that, the cricoid cartilage. Below that, the tracheal rings. At this point, I want you to note how the lower horn of thyroid cartilage is articulating with the cricoid cartilage, forming a synovial joint. Now let's connect the hyoid bone and the thyroid cartilage with the help of a thyro-hyoid membrane. Connect the rest of the cartilages too. Draw the oblique line on the thyroid cartilage. Begin to now color the cartilages. We should color the hyoid bone differently since it's a bone. Let's now color the thyro-hyoid membrane and the rest of the membranes that hold the cartilages together. At places, the membrane can thicken to form ligaments. So you can see that happening here, forming the lateral thyro-hyoid ligament. Here in the front, you can see formation of a cornus elasticus. Here is your epiglottis rising upwards from inside. Let's color that as well. Now all we have left is adding a few finishing touches. Begin to draw such tiny lines indicating that the connecting ligaments are fibrous structures. There you have your lateral view of the larynx and the laryngeal cartilages. Let's revise this quickly. So this is the diagram we have created, right? So what should we note in this diagram? What are we trying to learn out of it? We have learned that when we look at the larynx from the side, okay, we find that a bit of epiglottis is extending upwards beyond the hyoid bone. That's the hyoid bone. I can see this hyoid bone, its lesser cornu, greater cornu, and so on. Then what I see is a thyro-hyoid membrane attaching my hyoid bone to the thyroid cartilage. The thyroid cartilage is showing me an oblique line on the outer surface, and the posterior edge of it is extending upwards and downwards as upper and lower horn, right? Then I see that below the thyroid cartilage is a cricoid cartilage. Remember, the lower edge of cricoid is the lowermost end of larynx, right? This cricoid cartilage is attached to the thyroid cartilage anteriorly with the help of a ligament called cornus elasticus. So in this one diagram, I can see three cartilages of larynx: epiglottis, thyroid, cricoid. I can see a membrane, the thyro-hyoid membrane. I can see a ligament, cornus elasticus. And if you come to the membrane, you can see that it is laterally thickened to form a ligament called lateral thyro-hyoid ligament. Quite a lot we have learned by just drawing one diagram. Believe me, you learn a lot when you draw. You just have to have the patience and the intention to draw. Okay? So if you're liking my lectures, do like and subscribe to my channel.